Good morning, everyone. Bon vendredi tout le monde. I'm happy to be joined today by Ministers LeBlanc, Hajdu, and Anand, as well as by Dr. Tam and Dr. Njoo. First, let me begin by saying that it is with deep sadness this morning that we all learned of the passing of His Royal Highness the Duke of Edinburgh. Prince Philip was a man of service, motivated by a sense of duty to others. I know that through the Duke of Edinburgh's award, he helped empower millions of young people from all backgrounds, including here in Canada, to realize their greatest potential. And that's just one example of his many contributions. Prince Philip will be remembered as a champion for young people, a decorated naval officer, a dedicated philanthropist, and a constant in the life of Queen Elizabeth II. Le Prince Philippe était un époux, un père, un grand-père et un arrière-grand-père bien-aimé. Mes pensées et les pensées de tous les Canadiens accompagnent la reine Élisabeth II et tous les membres de la famille royale. La hausse des cas de COVID-19 continue d'être inquiétante. Dans plusieurs endroits au pays, des mesures plus strictes sont nécessaires pour freiner la propagation du virus. Mercredi, lors de notre 29e rencontre des premiers ministres des provinces et des territoires, j'ai répété aux premiers ministres qu'ils peuvent compter sur le soutien continu du gouvernement fédéral. On est là pour tous les Canadiens. Si vous en avez besoin, il y a plusieurs programmes en place pour vous aider. Si, par exemple, vous devez manquer du travail parce qu'un de vos jeunes enfants est malade ou que son école est fermée, vous pourriez être éligible à la prestation canadienne de la relance économique pour proches aidants. Si vous êtes incapable de travailler parce que vous êtes malade ou que vous devez vous isoler en raison de la COVID-19, vous pourriez être éligible à la prestation canadienne de maladie pour la relance économique. Ces programmes peuvent vous fournir de l'aide financière, que vous soyez salarié ou travailleur indépendant. Alors, à toutes les mères et les pères de famille qui travaillent fort et aux autres personnes qui ont besoin de soutien, n'hésitez pas d'aller sur le site canada.ca/coronavirus pour avoir toute l'information sur nos différents programmes. Il faut faire tout ce qu'on peut pour combattre cette troisième vague. Chaque effort compte et chaque effort peut sauver des vies. Right now, we're seeing more and more young people being admitted to hospital with COVID-19. So too young people. There are more contagious and more serious variants out there. Even if you're younger, you can get sick very, very quickly. Or you can give the virus to someone you love who can get very sick. I know you've already done so much and sacrificed so much, but we just need you to hang in there a little bit longer. And to people of every age, we still need your help. Together, we're going to get through this. Our path out of this pandemic is vaccines. So that's my number one focus. Vaccine delivery and rollout is something I talked about with the premiers on Wednesday. So far, we've delivered more than 10.5 million doses to the provinces and territories. And I know that they're working to get these shots into the arms of Canadians as fast as possible. This is a true team effort, especially now that we're in the ramp-up phase of the vaccine rollout. Every day, more grandparents and parents are sharing their vaccine selfies on family group chats. Every day, more Canadians are safer. Vaccines are saving lives. And that's why we're doing everything we can to get more and more doses to the front lines. Until the end of May, we're scheduled to receive 1 million doses a week of the Pfizer vaccine. In June, we'll have almost 2 million doses a week delivered from Pfizer alone. For Moderna, we'll be receiving 2 million doses in April and almost 3 million in May. And we're anticipating to receive over 7 million in June. What this all means is that by the end of June, we can expect to have received at least 44 million doses of COVID-19 vaccines from Pfizer, Moderna, and AstraZeneca. Our government is in close contact with all companies that have approved COVID-19 vaccines in Canada to get the latest information on shipment schedules and amounts. Everyone is working around the clock to make sure Canadians are safe. This is true on vaccines and is true on a whole range of other things people need to stay healthy. On that front, I can confirm that we are extending the support of the Canadian Red Cross until the end of September for up to 27 long-term care and retirement homes in Ontario, as necessary. The Red Cross will continue to help each home with their individual needs while supporting better infection prevention and control measures. Every senior deserves to be safe and to live in dignity, and we'll always be there for the residents of long-term care homes and their hardworking staff. To all of the Canadian Red Cross employees and volunteers, and to everyone at the Government Operations Centre who helps coordinate these deployments, thank you. You are doing incredible work. On espère tous que la pandémie sera bientôt derrière nous. Ce matin, on a appris que 303 000 emplois se sont ajoutés à l'économie canadienne pendant le mois de mars, ce qui comprend des emplois à temps plein et à temps partiel. Le taux de chômage est tombé à son plus bas depuis février de l'année passée. C'est une nouvelle encourageante, mais il reste encore beaucoup de travail à faire. On sait que plusieurs personnes sont encore sans emploi ou ont des heures réduites, d'autant plus que de nouvelles restrictions sont mises en place à travers le pays. We will continue to be there for families, workers, and small businesses. For those who need support, we've created the Canada Recovery Benefit, and we've strengthened employment insurance. For hard-hit businesses, we have measures in place that you can count on, like the wage subsidy and the Canada Emergency Business Account. Of course, there's also the Canada Emergency Rent Subsidy that can help your business or organization directly, including with additional supports if you're affected by lockdowns. As I've said from the start, we'll be here with the support you need. On that note, on April 19th, we will present our 2021 budget. We'll continue to focus on our plan to keep Canadians safe and healthy. We'll also share more about our plan to create good middle-class jobs so we can rebuild an economy that works for everyone. The pandemic has highlighted and worsened far too many gaps in our society. That's something we'll keep working on to address. And as we do, we'll continue to stand up for what matters to Canadians, whether that's finding a good, well-paying job, staying healthy, or having our kids breathe clean air. These are your priorities, so they're our priorities too, and they're priorities on which we will continue to deliver. As we've seen over the past year, it's vital that we all work together to get through this crisis. So that's why I'll be inviting all party leaders to meet individually with me to discuss the upcoming budget early next week. Avant de terminer, je veux encore remercier tout le monde qui fait des efforts pour aider à lutter contre la pandémie. Que ce soit les travailleurs de la santé qui sont fatigués et qui s'inquiètent de leurs patients, les travailleurs essentiels qui sont toujours au poste malgré les risques d'attraper le virus, ou tous les gens à la maison qui font attention et qui respectent les consignes de santé publique. Merci et on ne lâche pas. Il y a de plus en plus de gens vaccinés et ensemble, on va passer à travers. Merci. Je passe maintenant la parole à la docteure Tam. Theresa.
Bonjour à toutes et à tous. Today, we'll provide an update on current numbers and trends, as well as developments on the vaccine front. The race between vaccines and variants is at a critical point. The modeling prediction from 2 weeks ago that forecasts a resurgence is playing out in the data we are seeing now, with case counts plotting along the strong resurgence trajectory. It is clear that we need stronger control to combat variants of concern that are driving rapid epidemic growth in many areas of the country. To date, over 1,036,000 cases of COVID-19, including 23,200 deaths, have been reported in Canada. Over the past week, there have been an average of over 6,800 new cases and 30 deaths reported daily, and the number of people experiencing severe and critical illness continues to rise. Last week, an average of over 2,500 people with COVID-19 were being treated in our hospitals each day, representing a 7% increase over the previous week. 860 of these people were being treated in intensive care units, which is 23% higher than the last week. The increasing predominance of variants of concern is the major contributing factor to these worrying trends, resulting in accelerated spread and more severe illness, including among younger and previously healthy adults. Over the past week, the number of new variant cases has more than doubled. To date, almost 25,000 variants of concern cases have been reported across Canada, with B.1.1.7 variant continuing to account for over 90%. All of these trends tell us that, even as vaccines are bringing us closer to end this crisis, we cannot afford to give this virus an inch. In areas with epidemic growth, the only way to get out of this crisis is the hard way, by staying home as much as we can and consistently maintaining our distance and wearing a mask when we must go out. Several jurisdictions have tightened restrictions to control rapid spread, but let's remember that essential workers will still be there, providing the vital supplies, care, and support we need. With gratitude, let's commit to doing everything we can to protect them by staying home whenever we can. On the vaccine side of the race, it's been another busy week. Supplies continue to increase, with over 10 million doses of COVID-19 vaccines distributed across the country to date. Provinces and territories have administered more than 7 million doses and are further expanding programs as the supply ramps up. Our experts and regulatory authorities have also been busy, ensuring that vaccinations are optimized for use in the Canadian context and engaging with international partners on the in-depth review of vaccine safety data. This week, Health Canada attended the European Medicine Agency's Safety Committee meeting regarding the recent safety signal linked to the AstraZeneca vaccine. The European Medicines Agency, or EMA, has reviewed all currently available evidence and considered the risk of hospitalization and death due to COVID-19 against the very rare occurrence of combined blood clots and low blood platelets, known as vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT. There may be another name for this clinical entity coming out soon as well. Their assessment concluded that while there is a possible link between the AstraZeneca vaccine and this very rare blood clotting disorder, the overall benefits of the vaccine in preventing COVID-19 and its severe outcomes outweigh the risk of side effects. Last week, Canadian jurisdictions took the precautionary measure to pause the use of AstraZeneca vaccine in people under age 55, and to date, no cases of VIPIT have been reported in Canada. Health Canada will consider the latest evidence presented by the EMA, together with information being provided by AstraZeneca, to decide whether any changes are needed to the Canadian product label. The National Advisory Committee on Immunization will also review its recommendation in light of any new data in support of the provincial and territorial program decisions. Canada's health leaders are committed to working together, adapting approaches as the science and situation evolves, and keeping Canadians safe, healthy, and informed. We are getting closer every day, and we're more united and stronger for it. Thank you.
Bonjour à toutes et à tous. Aujourd'hui, nous présentons une mise à jour sur les données et les tendances actuelles ainsi que sur les développements relatifs à la vaccination. La course entre les vaccins et les variants est à un point critique. La modélisation d'il y a 2 semaines qui prédisait une recrudescence est démontrée dans les données que nous recevons maintenant. Le nombre de cas suivants sur la trajectoire liée à une forte recrudescence, il est clair que nous devons exercer un contrôle renforcé pour lutter contre les variants préoccupants qui stimulent la croissance épidémique rapide dans de nombreuses régions du pays. À ce jour, plus de 1 36 000 cas de COVID-19, dont 23 200 décès ont été recensés au Canada. Au cours de la dernière semaine, plus de 6 800 nouveaux cas et 30 décès ont été signalés en moyenne chaque jour et le nombre de cas graves et critiques de la maladie continue d'augmenter. La semaine dernière, une moyenne de plus de 2500 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, soit une augmentation de 7 par rapport à la semaine précédente. De ce nombre, 860 personnes étaient dans les unités de soins intensifs, ce qui représente une augmentation de 23 par rapport à la semaine dernière. La prédominance grandissante des variants préoccupants constitue le principal facteur qui favorise ces tendances inquiétantes, ce qui cause une vitesse de propagation rapide et des cas plus graves de la maladie, y compris chez les jeunes adultes auparavant en santé. Au cours de la dernière semaine, le nombre de cas de nouveaux variants a plus que doublé. À ce jour, presque 25 000 cas de variants préoccupants ont été signalés au Canada, le variant B117 continuant d'être responsable de plus de 90 des cas. Toutes ces tendances nous indiquent que, même si la vaccination nous rapproche de la fin de cette crise, nous ne pouvons pas nous permettre de laisser rien passer. Dans les régions où l'épidémie va en augmentant, la seule façon de sortir de cette crise devra se faire en appliquant des mesures rigoureuses, en restant à la maison le plus possible, en maintenant constamment nos distances et en portant un masque lorsque nous devons sortir. Plusieurs administrations ont renforcé leurs restrictions pour contrôler la propagation rapide. Mais rappelons-nous que les travailleurs essentiels seront toujours là pour fournir les biens essentiels, les soins et le soutien dont nous avons besoin. Démontrons notre gratitude, engageons-nous à faire tout ce que nous pouvons pour les protéger en restant à la maison le plus possible. Sur le plan de la course avec les vaccins, la semaine a encore été occupée. Les stocks continuent d'augmenter avec plus de 10 millions de doses de vaccins contre la COVID-19 qui ont été distribuées partout au pays à ce jour. Les provinces et les territoires ont administré plus de 7 millions de doses et continuent d'exécuter les programmes de vaccination à mesure que nous sommes approvisionnés. Nos experts et les autorités réglementaires ont également été occupés. Ils se sont assurés que les campagnes de vaccination soient optimisées dans le contexte canadien et se sont mobilisés avec les partenaires internationaux pour effectuer un examen approfondi des données probantes sur l'innocuité des vaccins. Cette semaine, Santé Canada a participé à la rencontre du comité sur l'innocuité de l'Agence européenne des médicaments, ou AEM, concernant le récent avis lancé contre la sécurité du vaccin d'AstraZeneca. Le AEM a examiné toutes les données probantes actuellement disponibles et a étudié le risque d'hospitalisation et de décès découlant de la COVID-19 et de l'occurrence très rare des caillots sanguins et de faible nombre de plaquettes, phénomène connu sous le nom de thrombocytopénie immunitaire prothrombotique induite par un vaccin, ou TPIV. Cet organisme a conclu que, malgré qu'il existe un lien entre le vaccin d'AstraZeneca et ce trouble très rare des caillots sanguins, les avantages généraux du vaccin pour prévenir la COVID-19 et ses graves complications l'emportent sur les risques d'effets secondaires. La semaine dernière, les administrations canadiennes ont pris la mesure de précaution de suspendre l'utilisation du vaccin d'AstraZeneca chez les personnes de moins de 55 ans. À ce jour, aucun cas de TPIV n'a été signalé au Canada. Santé Canada examinera les dernières données probantes présentées par le AEM de pair avec les renseignements fournis par AstraZeneca pour décider si des changements doivent être apportés à l'étiquetage de ce produit au Canada. Le Comité consultatif national de l'immunisation examinera également sa recommandation à la lumière de toutes les nouvelles données à l'appui des décisions prises dans le cadre des programmes provinciaux et territoriaux. Les chefs de file en santé du Canada sont résolus à travailler ensemble adaptant des approches à mesure que la science et la situation évoluent et à maintenir les Canadiens en sécurité, en santé et informés. Nous nous rapprochons du but, mais chaque jour, et nous sommes plus unis et plus forts à cette fin. Merci.
Thank you, doctors. We'll now go to questions from media. We'll start on the phone. Over to you, operator.
Thank you. Please press star one at this time. If you have a question, veuillez appuyer sur étoile 1 maintenant pour poser une question. Our first question is from Anna Thibodeau from CBC National News. Please go ahead. À vous la parole.
Good morning. Thank you for taking our questions. Prime Minister, clearly some provinces are struggling to respond to rising infections, hospitalizations, even deaths, and we know you've offered to help the provinces if they ask for it. But I think as Canadians sit at home and see these record-rising numbers in places like BC, Quebec, and Ontario, they might be saying, is it not time that you tell the provinces you're stepping in?
Thank you for your question. I can understand the frustration, the anxiety, the concern that Canadians right across the country are feeling at seeing these numbers rise. I share it. I think we're all recognizing that we don't want to be in this third wave, but we're here. And as we've been doing from the very beginning, we've been working very closely with the provinces and territories to ensure that they have the supports necessary to make the right decisions for their jurisdictions. The caseload and the trajectory isn't the same right across the country. And what we've done as a federal government is stepped up so anywhere across the country, if there is a shutdown, if public health orders require people to stay home and they can't go to work, if small businesses are affected, our federal supports are there. Whether it is direct income support for workers who've been laid off, support for small businesses through the wage subsidy or through the CEBA business account or through the rent subsidy with a top-up for lockdowns, whether it was direct support of well over $19 billion we sent to the provinces and territories to help them managing their healthcare systems, dealing with rapid testing, dealing with vaccinations. We will continue to be there to work hand in hand and respect the provinces as they make the right decisions for their jurisdictions.
Follow up, Hannah?
Oh, yes, please. Thank you. Okay, so I take that as a no, that you don't feel you have to step in. And I want to move on to federal supports. So given how hard this third wave is hitting some communities, is there anything more you can do to encourage workers to stay at home when sick? Could you increase the amount or make a tax rebate for companies?
We have brought in the Canada Sickness Benefit to make sure that if people start seeing symptoms or they're required to self-isolate, they can collect support from the government while staying at home, so they can keep putting food on the table, so they can keep paying their rent, even if they're staying home to protect their loved ones and their community. There are many measures that this government has put in. We're always open to more, but I will highlight that we've already, when we designed most of these measures, built in natural or responsive adjustments to make sure that as future waves could hit, as we see right now, those systems would be in place and would adjust to be there to help the most vulnerable. We've already extended them to the summer, and we will continue to watch very closely to see if there's more we need to do or if we need to extend them even longer. We made a promise to Canadians that we'd have their backs. That's exactly what we're going to do for as long as it takes, with as much as it takes.
Thank you. Next question, operator.
Thank you. Our next question is from Marieke Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Good morning. Thank you so much for taking our questions. Prime Minister, you'll be speaking at your convention, your party's convention tomorrow, but tonight we're hearing from Mark Carney. Are you hoping he'll run as a Liberal candidate in the next election?
The Liberal Party has a long history of welcoming in expert speakers at our conventions on from a range of different backgrounds. We're very pleased to have someone of the stature of Mark Carney, who's been working very, very hard on, among other things, the intersection between the global economy and the fight against climate change. I know Liberals are very excited to hear what he has to say, and it's just another example of how we work together to listen to experts and the best and the brightest from around the world as we look at how to continue to focus on getting Canadians through this pandemic and on building back better.
Follow up, Marika?
And last night, thank you. Yeah, last night, Deputy Prime Minister Chrystia Freeland again made it clear how much of a priority some sort of national childcare program is for her. The issue has gotten a lot more attention under your government since she took on her new position as finance minister last year. I'm wondering if you can tell us your perspective on what you believe a national childcare program should look like in Canada.
I know people are very much looking forward to the budget on April 19th, in which we will share our perspective on how to grow the economy, how to create jobs, how to support Canadians, how to make sure that the middle class and people working hard to join it comes through this pandemic and our economy comes roaring back. The Liberal Party has been talking about childcare for a long time, and indeed, over the past 5 years, we've transferred billions of dollars to the provinces to improve childcare across the country. But we know, and this pandemic has certainly highlighted, that there is more to do. What we're seeing is that people have finally understood what the Liberal Party has long known, that childcare is not simply a social argument or a social program. It's fundamentally an economic program, getting more women into the workforce, allowing families to not have to make impossible choices between having another child or staying in the workforce. These are things that are good for the economy, and the business community right across the country has spoken up clearly and strongly in support of something that families and indeed women across this country have known for a long time. Childcare is something we need to do as a country.
Merci. Prochaine question. Operator.
Thank you. Notre prochaine question nous vient de Geneviève Normand de Radio-Canada. À vous la parole. Please go ahead.
Oui, bonjour. Je vous lance ma question à tous les deux, M. LeBlanc et M. Trudeau. Êtes-vous capable de penser à un souvenir avec le prince Philippe? Et êtes-vous capable d'élaborer peut-être sur les liens que vous, le Canada, avez entretenu avec le mari de la reine au cours des dernières années, des dernières décennies?
Certainement, c'est avec une grande tristesse qu'on a appris de la mort du prince Philippe. C'est quelqu'un que j'ai connu toute ma vie. Les premières fois que je l'ai rencontré, j'étais un jeune enfant ici à Ottawa. Mes meilleurs souvenirs sont des conversations que j'ai eues avec lui depuis plusieurs années, notamment lors de la rencontre du Commonwealth à Malte dans mes premiers mois en tant que Premier ministre. C'est un homme fascinant qui a toujours été dévoué au service et à la reine. Et nous le regrettons profondément avec son passage. I have known, had the privilege of knowing Prince Philip almost my entire life. The first times I met him, I was just a kid here in Ottawa many years ago. But obviously, over the past few years, I've had the opportunity to have a few more conversations with him. And it is a tremendous personal as well as public sorrow that we all share at his passing. In Malta a few years ago, actually a few months after becoming Prime Minister for the first time, I was able to have a number of wonderful conversations with him, and he is going to be sorely missed, not just by his family, but obviously by all of us. Dominic?
Merci, Monsieur le Premier ministre. moi aussi, je partage la tristesse de tous les Canadiens quand on a appris ce matin le décès de Son Altesse royale. Le premier ministre a bien souligné le service incroyable qu'il a rendu depuis de nombreuses années, de nombreuses décennies. Évidemment, son dévouement à Sa Majesté aussi a touché, je pense, des millions de personnes à travers le monde. Moi, j'ai un souvenir d'avoir passé une soirée informelle. C'était littéralement un barbecue, la fête du Canada. J'essaie de me rappeler si c'était en 1997 ou 18. Sa Majesté et le Prince étaient à Ottawa et mon père était alors gouverneur général et il y avait une soirée libre et Sa Majesté avait suggéré un barbecue informel, juste 2 tables de 8 personnes. Et j'ai eu la chance d'être à la table avec le prince Philippe. Et comme le premier ministre, j'étais touché par ses connaissances du Canada et la façon qu'il parlait du service des jeunes personnes et comment il avait dévoué tellement de temps à cette cause-là.
And in English, please.
I share the Prime Minister's comments, obviously, with respect to the sad news we learned this morning, the sad news that affected all Canadians with the passing of His Royal Highness Prince Philip, the Duke of Edinburgh. I, like the Prime Minister, have a particular memory of having spoken with him 25 years ago, probably, at an informal barbecue that Her Majesty had suggested be organized at Rideau Hall when they were in Ottawa for Canada Day. They had a free evening, and Her Majesty suggested that perhaps a summer barbecue. There were only 2 tables of 8 people at the dinner, and I had the chance to sit at Prince Philip's table and remember fondly his knowledge of Canada, his interest in Canadians and in Canada, but the passion with which he spoke about his service to young people. That is a memory I will always cherish.
Geneviève? Okay, we'll turn to the room.
Canadian Press. Thanks, Prime Minister. Have you asked Mark Carney to run as a Liberal in the next federal election, or are you trying to persuade him to?
As I said, Liberal conventions are always an opportunity to gather as Liberals and reflect on the ideas that can push Canada forward, that we will continue to discuss and debate between elections and building a platform. One of the things that we've always done is brought in strong voices who contribute to our reflections, sometimes partisan, sometimes independent, but always they feed the discussions that we have. And I'm very pleased someone with the expertise, particularly in the combination of economy and environment that work together, that is something that the Liberal Party has always stood for. And I look forward to seeing Mark's speech tonight.
Thank you. And I'm going to note you didn't answer the question, Prime Minister. On the universal basic income, you in the past have expressed that now is not the time to create or introduce a universal basic income. Members of your caucus obviously feel differently. Have you changed your mind, or is now still not the time to introduce a universal basic income, or do you feel differently?
I think one of the great things about Liberal conventions is people put forward strong and challenging ideas that get debated and discussed and looked at by people from right across the country. I think it's a wonderful opportunity. We know in the past that challenging proposals brought on the floor of the Liberal Convention made it into policy and have shaped Canada over the past number of years. So I'm not going to comment on any specific resolutions, but I know that what Liberals are going to do this weekend is talk about a wide range of great ideas that will help move Canada forward. What they won't be doing this weekend is debating about whether climate change is real. That debate is settled for Canadians.
Prime Minister, Mike Lucatore with Global National. Dr. Tam just said, quote, "It's clear we need stronger controls in place." Your government can do more. And I just wanted to ask you, in the past, you have not hesitated from calling out premiers on climate change and their lack of action on it. So I just want to know why you're so hesitant to call them out for not getting shots into arms quicker.
I think one of the things that we've seen from the beginning of this pandemic, Mike, is the Canadians have been reassured by the fact that different orders of government are working together. And that has been something that is both reassuring, but also confidence building in a population that is rightly anxious about the path of COVID-19. Provinces and the federal government have worked together through this pandemic, whether it's been federal investments to support the provinces in healthcare, in rapid testing, in PPE, and now the federal government paying for vaccines that are being administered by the provinces. We are there to support them as they need to get vaccines in arms. And quite frankly, this has been something that we've worked on together over the past many, many months. We will continue to be there, and the provinces have just as much of a priority as everyone else to vaccinate as many people as possible, as quickly as possible, and that's what Canadians expect.
I just want to follow up on vaccines, and there's been criticism in the past for not getting more vaccines in the country sooner, and I know that you just mentioned that there will be 44 million by June, but do you think it was a mistake not to push the manufacturers to have more precise deadlines rather than just on specific, or I shouldn't say even on specific, just to have them delivered by a certain quarter? Would you not have preferred to have them A, earlier, and B, a more specific timeline for them to be in the country?
I think obviously we would have loved to have more vaccines much quicker, but let's remember, and I'll turn to Minister Anand for a follow-up on this, let's remember that there were no vaccines around against COVID-19 a year ago. These are brand new developments that the scientific community, the international community, experts have worked on incredibly hard over the past many months. And we are unbelievably lucky as humans that we have collectively been able to develop not just one effective vaccine against this virus, but many effective vaccines. But the challenge of developing a safe and effective vaccine is one. The second challenge is producing that vaccine at a scale that is going to make a difference around the world. And pharmaceutical companies and indeed countries around the world have stepped up to contribute to make sure that we are producing as many as possible and getting them out to people around the world. So we had commitments for 6 million vaccine doses arrived in Canada by the end of March. We blew through that target and got more. And over the coming weeks, we're going to be getting even more vaccines in. The end is definitely in sight, but we're not there yet. This third wave is more serious, and we need to hang in there for another few weeks to make sure that we can flatten that curve, drop those numbers down again, to give a chance for vaccines to take hold and to allow us to get to what will hopefully be a much more normal summer by the time the weather turns really nice. Anita.
Thank you so much, Prime Minister. At the time of contracting, we did not know whether a vaccine would be produced and when. We did not know the time of regulatory approval. And that goes for the vaccine suppliers themselves. As a result, the suppliers were reluctant, indeed refused to provide anything more than a quarterly delivery schedule. They would not provide weekly delivery schedules because of the fact that there was no vaccine in existence. As the Prime Minister mentioned, we began the quarter with 6 million vaccines targeted to come into the country. We ended March with 9.5 million vaccines in the country. We are accelerating rapidly in terms of our deliveries. We will see Q2 looking very different from Q1. For example, 6 million doses will be arriving in April. 7 million doses will be arriving in May, with 44 million overall prior to the end of June. Right now, 17%
of Canadians have received at least one dose of vaccine. Canada stands 7th in the G20 in terms of doses administered per 100 people. As we have repeatedly said, our vaccine procurements and deliveries are rapidly accelerating. We have moved 22 million doses from later quarters to earlier quarters in the year, including, as I mentioned, 44 million doses expected prior to the end of June. We will keep working every single day with our suppliers to aggressively push them to deliver more doses earlier and earlier to Canadians. That's our government's priority, and that's what we'll keep working on. Thank you.
Thanks, Prime Minister. Kristen Ashkate, CTV National News. This question is for you, but also Minister Anand. Dr. Fauci has said that even if AstraZeneca gets approved, there is no plan to use the vaccine in the U.S. The Americans will soon have 90 million doses of AstraZeneca made and sitting unused in storage. But Canada has only received 1.5 million AstraZeneca doses from the U.S. Why haven't you been able to get more of those unused doses into Canada?
We continue our discussions with the American administration on getting more doses into Canada. We understand that they made the decision around vaccinating Americans first, particularly under the previous administration, but that continues under this one. We will keep working with them and ensure that we get more doses as soon as we can.
I might just add to the Prime Minister's comments that we, in our contracting, were deliberate in terms of ensuring that we could pull vaccine from many geographical locations in the world, the United States included. But at the current time, please note that we are pulling vaccine from Europe, from India, from South Korea, and from the United States. AstraZeneca in particular is one vaccine that we are ensuring we have a diversified source of supply from multiple locations. In terms of continuing to bring supply in from the United States, let's just remember that it's as a result of our contract for 20 million doses of AstraZeneca to be produced in the United States that we were able to do the exchange agreement with the United States so that when we have that 1.5 million doses in the country, which arrived last week, we will then return 1.5 million back to the United States. That's a very good model for additional deliveries into Canada. We are continuing to discuss this possibility with the U.S. administration, including through the excellent work of our ambassador, Kirsten Hillman. Thank you.
And thank you. And this next question is for Dr. Tam or Dr. Njoo. The European Medicines Agency has said they've started a probe into the Johnson & Johnson vaccine due to reports of the same blood clotting issues that have impacted AstraZeneca. What info does Health Canada have about this right now?
This is Theresa Tam. I can't speak directly to exactly what the regulator has. I'm not from that area, but I know that as per the clotting and low platelets issue related to the AstraZeneca vaccine, Health Canada is connected with all of its international counterparts, including the FDA. Of course, the EMA that has been investigating the AstraZeneca vaccine as well. It was always an area of increased vigilance and further inquiries because, as you may already have appreciated, the J&J vaccine or Janssen is the same type of vaccine, the viral vector vaccine, as the AstraZeneca vaccine. So with all due diligence, people have been actively looking for some of these similar cases with the J&J. So we're just beginning to see that coming through with the reporting. But I think as with the previous process, Health Canada will do their work. And then as needed, based on the information available, the National Advisory Committee on Immunizations and others will also be completed their work as they did with the AstraZeneca vaccine.
Thank you, Doctor. We'll now return to the phone for the one follow-up question. Operator.
Thank you. We have a question. Notre prochaine question est de Geneviève Normand de Radio-Canada. À vous la parole. Please go ahead.
Oui, merci de prendre ma question de suivi. En fait, c'est à propos du congrès qui s'en vient. Il y a plusieurs des résolutions qui vont être débattues lors de votre congrès qui ressemblent étrangement à celles qui sont débattues au congrès du NPD, M. Trudeau. On n'a qu'à penser, par exemple, au revenu minimum garanti. Alors, comment comptez-vous convaincre les Canadiens que votre offre électorale est visiblement la meilleure?
Je pense d'abord que notre priorité maintenant en tant que gouvernement, en tant que Parti libéral, c'est de s'assurer qu'on protège les Canadiens du coronavirus, qu'on est en train de rebâtir en mieux. À ce niveau-là, évidemment, les militants libéraux vont discuter de bien des différents enjeux pour améliorer, pour contribuer, pour aider les Canadiens à bâtir un avenir plus fort. C'est ce qu'on fait tout le temps dans les congrès des partis. J'ai bien hâte d'entendre ces délibérations et de voir à quel point des débats et des discussions vont alimenter notre vision pour un avenir meilleur pour les Canadiens, pour la classe moyenne, pour ceux qui travaillent fort, pour s'y joindre. Mais dans toutes les discussions qu'on va avoir cette fin de semaine sur bien des sujets, je peux vous assurer d'une chose. Il n'y aura pas de débat de voir si les changements climatiques sont réels ou non. Pour les libéraux, c'est un enjeu qui est très, très clair.
Thank you. That concludes the time the Prime Minister has for questions. The doctors and the ministers will be around for a little bit longer, and we'll start on the phone once the Prime Minister has left the room. Operator, back to you.
Thank you. Our next question is from Marika Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Hi, thank you for taking my question again. My question is for you, Dr. Tam. You said very starkly in your opening comments that it's clear we need stronger controls to combat variants of concern. Can you be very specific in what you mean by stronger controls? What are you looking for?
So this virus is spread person to person. And so it's really reducing contacts, which may mean also reducing mobility and essentially mixing. And so we have seen a number of provinces stepping up the measures just in the last days, including where I'm sitting, Ontario. That is really critical. So, the messages being sent out is right now in the Ontario setting, for example, is try to stay at home as much as possible. Don't go out and it's for essential things such as your specific work, because there are essential workers, as I said, who has to go to work, as well as, of course, for healthcare or other essential activities outside. But where possible, you should try and stay at home. So these are some of the types of measures that will reduce those contact rates. So in the modeling, for example, we model contact rates between people, and you need to reduce those contact rates to get that curve down. And you've seen Quebec doing other measures as well, including in their context, the curfew. And I think that many of the jurisdictions, chief medical officers have told me that, of course, there are outbreaks in different settings, but a lot of them have observed social gatherings. So really important that every person in Canada knows that you should not be gathering in any numbers and in any great numbers and follow your local public health advice. But in the Ontario context, for example, do not mix with people outside your own household. So those are really critical. You've heard all those measures before. And also individually, the usual individual personal protective measures that we keep mentioning, wearing masks, washing your hands, don't go in closed, crowded, poorly ventilated areas. So those are really critical. You've seen what happened in Europe with Ireland and the United Kingdom. This is only really with those kind of measures that were able to get their third resurgence under control while their vaccine programs have been escalating. So that's pretty critical.
Follow up, Marika?
Yeah, thank you. I'm just still unclear what is different. You're pointing to Ireland and the UK. Can you give a very clear, specific example of what rule is different than what we have here? Is it that you should only be going 5 kilometers within your address? Like, what is the specific rule? Because we've been told for a year now, reduce contacts, and obviously that's not working. So what is the specific rule that the UK or Ireland had that Ontario, for example, does not?
Well, I think Ontario just put down very specific measures. They do know what to do if you've looked at the fact that they've had to control that second resurgence well. And so it is exact same thing, except you have to do it even more diligently when you got a more transmissible virus. It is very different in different contexts. Perhaps there's different parts of Ontario that's more similar to the social structures and mixing and connects in the United Kingdom, but Canada is a really big country with different situations. So every jurisdiction has to understand the local context. But as you've seen, limiting store openings to the essential. Many of them have now closed down some of the, places that have been open right up until more recently. Some of them have closed down things like in-room dining, gyms, all of those things, and some have gone down to, virtual schooling again. So we know all of those things just simply reduce the amount of contact people have with each other, and provinces have to look at what works for their own context. But ultimately, in the end, though, you have to have the collaboration of your public and the trust. And so I think that is actually really tricky to do at this time that people are kind of exhausted. But we do have the vaccine, so I think provinces are also trying to roll these out, and they've been adjusting their strategies as we speak in order to, some of them are targeting areas you've seen in Ontario, areas where there's more heightened risk in cases. So all of those measures are being put to bear, but it is very similar to what they did before, but you've just got to do it with less room for error.
Thank you, Doctor. We'll take one more call on the line. Operator.
Thank you. Our next question is from Anna Thibodeau from CBC National News. Please go ahead.
Hi, thanks again for taking another question. This is for Minister Anand. I'd like to ask, I know you were saying earlier that there was supposed to be an update on the J&J vaccine this week. Is there anything you can update us on that?
Thanks so much for the question, Hannah. I have been speaking regularly with J&J, including this week and over the last number of weeks. As you may know, we are one of only 9 countries that J&J has a contract with, and at the current time, the only country being served with J&J vaccines is the United States. Production of the J&J vaccine for Canada will occur in a number of locations, including in Europe and the US. And we will have a delivery schedule hopefully next week, with deliveries beginning at the end of April, as I have previously mentioned. Thank you.
Thank you. My follow-up question is a question for Minister LeBlanc, if that's possible. Minister LeBlanc, you've been working with the provinces quite frequently. Canadians are sitting at home, and I see it consistently, people frustrated that the vaccines aren't getting out there fast enough. Would you say, so from provinces like Ontario in particular, they've said they haven't had a consistent, secure supply to get out there, but not only Ontario, Nova Scotia, Manitoba, and BC have said that, but also you hear from your government that there are about 20 to 30% that aren't being put into arms. What would you say is the biggest problem about getting vaccines out there right now between those two things?
Well, so Hannah, I think Canadians properly expect governments to work together collaboratively on something as important as procuring and then ultimately delivering vaccines into the arms of Canadians. Our government, as Anita described, I think has done a terrific job in procuring as many different vaccines from a diverse group of suppliers as quickly as possible. And we've had the lucky problem of having more vaccines arrive more quickly than we may have initially expected in February or in March. That's good news. So the provinces have also been able to ramp up in different models in different jurisdictions across the country. I spoke to Premier Ford, for example, last night about the Ontario vaccine rollout campaign and said that, as always, the Government of Canada is ready to help and do what we can. But we're confident, Hannah, we're very confident that all the provinces and territories will effectively and efficiently administer vaccines to the priority populations that they determine in the way they follow their public health advice. So we're going to continue to be collaborative and continue to work with provinces and territories. That's what Canadians expect us to do. And we think that over the coming weeks, Canadians will see in every jurisdiction across the country a very effective vaccine rollout.
Thank you. And we'll return to the room for a few more questions. Mike.
Couture with Global National. This is for either Dr. Tam and or Dr. Njoo. You mentioned it, Dr. Tam, we've had a long year. You've had a long year with pleading with people to follow public health guidelines. How worried are you right now about the trajectory that Canada is on?
So right now, as I've mentioned at the beginning of my remarks, we put out different modeling, and of course, some of it looked, quite alarming when you look at those curves. And unfortunately, we're following that sort of trajectory, the one that we didn't really want to follow, with a sort of rapid acceleration of cases. But all I can say is, of course, that again reflects what happened a couple of weeks back. Many of my colleagues are sort of course, worried about what happened at the Easter long weekend. So all of that will be playing out. But we can do something about it now. Even countries, as I said, like the UK or Ireland, that had a massive spike. As soon as you put on those brakes, and many provinces are now doing, you should see that come into effect. And they do work, and they worked in Israel and other places as well while the vaccination programs are rolling out. So I think that, yes, we are concerned. We've seen the B117 variant essentially replacing the pre-existing viruses very efficiently in many parts of the country, and that is a virus that spreads easily, as well as the other two variants as well, much less so, as I said, 90% B117. So we've seen what it can do in the United Kingdom. So those same measures, we just talked about them, absolutely works, but people need to be able to follow them. While the vaccine absolutely brings us hope. These vaccines are remarkable in so many ways. So when I saw the cases going up, what is really important is that we're still seeing the reduction in the over 80-year-olds, although some of that plateaued, but the long-term cares have been, seniors there have been protected. So I think it's absolutely reminding people that people at all ages, while you're younger, you have less risk of severe outcome. But right now, what is of concern is actually, to me, is the ICUs filling up. It's not just hospitalizations. There's an absolute limit to ICU capacity, not necessarily because of equipment, but because of people, health workers and technologists and other support to those ICU teams. You cannot grow those things rapidly. So I think the concern really is those kind of indicators.
Dr. Njoo, maybe I can add some personal reflections as well. I think to your question about people being tired and so on, I can't speak for Dr. Tam, but I'm tired. I think we're all tired. You know, it's been a long year. You know, we're now in the third wave, and then now with the variants, spreading as well, and ICUs filling up in many parts of the country, it's quite concerning. So I think we're looking for hope, and I think maybe I'll just expand on my comments. I think I made yesterday at a technical briefing. You know, vaccines offer hope, and I think we shouldn't lose sight of that. But the part about once you get vaccinated, then hey, you're out of the woods. I think we in Canada we have a collective approach. And I think we all get it that, none of us are protected, that all of us are protected. So as we ramp up our vaccination, it's still important that, as we get to this certain vaccine coverage that hopefully will then allow us to do more and more activities, that we need to maintain the public health measures. I know we sound like a broken record with, repeating the mantra of the hand washing, the physical distancing, and the use of masks and so on. But that's so important, especially now with the third wave upon us. And then as the vaccine rollout, proceeds, then I think the mantra I would use is say, hey, let's not focus on dates. It's the data, not the dates. So look at the indicators. There's some good evidence right now that certainly is making a difference in helping to dampen down in terms of severe consequences and death, those who've been vaccinated. And so hopefully all of the indicators will also trend in the right direction as more and more people get vaccinated. So I think that's the hope. Let's look at the data and not the dates. And if all goes well and every Canadian that is offered a vaccine hopefully actually takes it up as well, that'll be key, because we can certainly have all the vaccines available in the country and they could all be available, but it's still a matter of Canadians having, I think, the confidence and going forward and taking up the offer to get vaccinated. I think it's not just for yourself and your friends and your family, it's also for other people in the community that you may not know, because I think the group coverage or the vaccine coverage at a community level is so important for all of us, so that we can get back, as they say, as much as possible to the lives we knew before. So thank you.
And maybe I can just jump in. It's Patty Hajdu. I do want to just say that controlling the virus is actually critical to our provincial, our local, our national economies. I think we've shown over and over that balancing the economy and the health of Canadians is really a tricky balance. And in fact, what I think from around the world, the evidence is starting to accumulate that you actually can't have a healthy economy until you get COVID-19 under control. And that's what we all have to stay focused on here, is making sure that we save lives, that we stop the spread, and that we protect our economies while we do so. And so that's to the Prime Minister's comments why the federal government has been so invested in supporting Canadians from a financial perspective and supporting provinces and territories from a resources perspective. And we're going to continue to do that and have the backs of every Canadian so that we can get through this strong and healthy together.
Theresa Tam, CTV News for Dr. Tam. The UK is projected to get herd immunity on Monday with 70% of the population either vaccinated or previously infected. What is the number of Canadians who need to be vaccinated for Canada to reach herd immunity?
Well, I certainly look towards UK data with great interest. Obviously, each country uses different vaccines as well. We know vaccines are extremely good at preventing serious outcomes and deaths. What we know less about is their ability to prevent any kind of infection and onward transmission. But there are some early signals, particularly I've seen certainly with the mRNA vaccine. We need more data from the AstraZeneca vaccine, but the pointing towards people having a reduced viral load, for example, in the back of your nose, those are all good signs that these vaccines may provide a degree of reduction in transmission. Exactly how much, we don't know. So, obviously a country like the United Kingdom that has vaccinated a large number of the population, and particularly because they use a stretch interval, most people in the United Kingdom having had mostly one dose at this point, we absolutely will be able to see what happens when they are just beginning to relax some of the public health measures. So I think that's really critical for us to collect that international data. So in the Canadian context, we have different mixes of variants, although they also have the B117, and we have right now the B117 variant. And the more transmissible the viruses you have, the higher the vaccine coverage that you're going to need. And so it all depends. So the variables that we'll be looking at to finally determine whether community protection, if you like, can be achieved depends on the vaccine effectiveness overall, the vaccine effectiveness to prevent transmission where there is uncertainty, the amount of variants, so the speed at which those variants spread. But in particular, we should watch very closely the impact of variant on the vaccine effectiveness itself. And of course, ultimately, it is about what viral activity there is in the community. But those kind of parameters has to be determined. And the other aspect, as I've said, in the concept of reopening society is that there's enough ICU, hospital, and public health capacity. So those are really important parameters. I mean, it's great to see a ballpark of 70%. What I would like to see is us being able to keep re-evaluating that ballpark as we go along. And as we approach the end of that second quarter and moving into the summer, to see whether that is in fact a reality that can be achieved.
Stephanie Taylor with the Canadian Press. Minister Anand, when Canada received doses of AstraZeneca last month from the US, we had to sign an indemnity agreement. Can you explain why and what liability we took on as a result and how this is different from the liability exemptions with other vaccine contracts?
The liability remains consistent across our contracts and agreements. They are standard indemnification clauses in all of our agreements. There was nothing in particular about this particular document that you mentioned.
Thank you. And I'll use my follow-up for Dr. Tam. Dr. Tam, many of your colleagues and others in the medical community are seeing some of their worst fears realized that they were expressing as far back as the first wave in the third wave. So given that, and given folks like yourselves and others were warning for weeks, if not months, that the variants were coming and risk the third wave, how did Canada find itself so unprepared for this season?
Obviously, the individual public health measures are done locally and provincially, but all I can say is it's not too late. You know, you can keep looking back, but right now, put the brakes on, get this curve under control, and get the vaccines up and running. I mean, before in the preceding waves, we didn't have the vaccine, but don't be complacent just because we have vaccines. The vaccines are not going to be able to help with a sort of flattening that curve this immediately. You know, we're making progress, but not enough Canadians have been vaccinated, and most of them have only had one dose. So we got a long ways to go in the vaccine program. So don't squander that opportunity and just put on the brakes now. It will work. It's just you gotta be really stringent and leave less room for error, as I've said. But people should know what to do by now, and just need to, as I've also said, the faster you get on with these measures, the faster you can come out of them as well. Vaccines will add an additional layer, but vaccines, remember, take a number of weeks to work. So after that first dose, 2 weeks, maybe 3 if you're in an older population. That does not help rapidly cut down on transmission. It's those public health measures that will.
Thank you, Dr. Tam. And that concludes today's press conference.